And so we want to talk about our benefits for the nursing homes, like HammTek benefits for the nursing homes. First of all, the trip costs for all of the nursing homes, like private and public, it's the same. So the trip costs for a patient, it's not cheap at all. Like they pay the transportation going to the dentist and back, whether it's a taxi or anything else, it must be paid. And they pay for the diagnosis itself, and then they pay for the extra hours for extra nurse, maybe, because anyway it's out of the schedule of the nursing home, so anyway they have to pay extra. This is the extra cost that it will be gone when they use HammTek, because HammTek, it will be like one device in the nursing home, and they will use it for all of the patients. They don't need to pay extra money for this trip. They don't need to pay extra money for extra hours. It can be scheduled within the day, within like one day, within a month. It will be more easier. Second point we want to talk about is the complications for the patient and for the staff. For all of the staff, like the staff of the nursing home and the staff of the hospital. For example, in the hospital, we always receive these kind of patients that sometimes they have bacterial diseases, and when they come to us after this very complicated trip, they have to use many things to come to the hospital like safely. These patients with bacterial diseases, we have to like cover the whole the dentist and the nurses in the hospital, and I think maybe also the nurses that they were working in the nursing home, that they're accompanying him to this trip to the dentist, because some diseases are can be transferred. So at this point, really these trips from any nursing home to the dentist is subjecting the whole staff and the patient itself for many complications. With HammTek, what will happen that when the nursing home use the HammTek in their place, nobody will be subjected to any complications. Like, for example, if a patient has bacterial disease, yeah, it can be transferred and he can have complications, but with HammTek it will be like 1 or 2% maximum, and it will be like the normal percentage that any patient or any staff can be subjected to. But when a patient go outside their home with these kind of diseases, he can be really subjected to many complications during the transfer, at least the transfer from the nursing home to the taxi or to the bus, and then from the bus to the dentist again. And sometimes when he go to the dentist or even the emergency hospital, he has to stay and wait for like 15 minutes, or sometimes he waits like more, he waits half an hour or maybe 1 hour. So this is subjecting the patients of the nursing home to many complications. And with HammTek, we are saving all of these problems. We are erasing all of these problems with the usage of only one device in the nursing home, without subjecting all of the staff and without subjecting the patient himself to many complications. Now we will talk about another problem, which is the shortage of workers. And it's not only a problem for the nursing homes in Finland. Basically, we did have listened to many comments about this topic, and many articles have written about Finland, about this problem that is increasing in Finland, that there is shortage of workers. So basically, in this trip for the patient from the nursing home to the dentist, we do have this problem as well. For example, the nursing home will make this trip, will make a plan for this, and they have to find like extra nurse to stay. They have to make shifts, like one stay in the nursing home instead of the other that will go with the patient. And usually it's not only one nurse, basically it will be at least 2 nurses. And this thing we have it like daily in the hospitals. So for this problem as well, HammTek, you can take benefit from the device about this problem. this problem, it will be solved, because the same nurse who is beside the patient, it will be the same nurse who will use the device, and the usage of the device will take like maybe 5 minutes, or at least the whole process 10 minutes, with taking the all videos for the all teeth, and as well to have the report by our AI software. So it will not take time at all. It will not take like planning to have an extra nurse, not an extra nurse in the nursing home that must be instead of the two that went with this patient to the dentist. So also this shortage of workers will be solved with our device HammTek. Another problem that we have to mention is that the aging of population is increasing, and it's not increasing only in Europe, it's increasing globally, especially for example in UK and Germany. And this means that our HammTek device will be really beneficial for the nursing homes, because the number of patients will automatically increase, and our device will make it so much easier for the dental checkups, the dental follow-ups, and for sure the elderly patients need it more often, because they already have another diseases, and this is most probably the case. And while they are not checking their teeth, basically this make more complications to their health. So with the aging of population, we are offering as well this solution that the nursing homes will take benefit from, and this will increase really good dental health for the elderly patients.